Pursuant to Standing Order 5.02, it is now time for petitions qualifying for debate. I call on the clerk to read the petition title.
Petition, amend the Health Legislation Information Sharing Bill to 2023.
Mr Limbrick.
Petition be taken into consideration. Today I stand for 10,000 Victorians who in just 3 days signed a petition to trigger this debate about medical privacy and consent. This is the first debate of this kind and a significant moment in the history of this parliament, and I thank every one of them for giving me this opportunity. So here's the message. Our medical information is deeply personal information. No person, no doctor, no politician, and certainly no government should share it without our consent. They want members here to wake up from their power trip and show some respect. Privacy and consent are not about politics. It's not about whether you're a left or right or red or green or blue. This is about respect. It's about empathy for others and being decent. Privacy is essential to who we are as human beings. It gives us a space to be ourselves without judgment, allows us to think freely without discrimination, and allows us to control our own lives. You don't go rifling through other people's handbags, wallets, or bedside drawers. It's rude and disrespectful. Who here wants to hand me their phone or their browsing history? Who wants me to read out their medical records? Would you like me to tell everyone here about the pills you take, or your warts, or your birth control, or your fertility? If I did, you would be outraged. I would be denounced, and what's more, you would be right to be outraged because it would be a low act. Well, at least 10,000 Victorians, in fact many more, are outraged that anyone would share their medical information without their consent. Nobody should be forced to share their private health information without their consent. Of course they shouldn't. It's amazing that this even needs to be said. Many Victorians have told me through emails and social media what medical privacy means to them. Nearly everyone has a unique story. Some are concerned about their recreational drug use and it could be held against them. These are meant to be private battles. Of course they are. IT professionals say they don't trust the management of the medical records. Some healthcare workers are concerned their information could be accessed by workplace bullies. Mental health professionals say that they're afraid people might hold back vital information. And it's also a worry that on International Women's Day it's necessary for me to explain the importance of medical privacy to women. Some are petrified because their abusive exes work in healthcare. Some are worried about information about abortions could be discovered by their husbands or families. Victims of stalking know that abusers simply don't care about boundaries. Just ask Diane McDonald, who might be the bravest person I've ever met. Those of you who watched Australian Story episodes called To Catch a Stalker will know about Di, who has spent 7 years in torment. Despite concerns for her own privacy, she's spoken out to defend the privacy of all stalking victims. At Parliament, she asked last sitting week, what about our human rights? So what about our rights? And what about their safety? Her privacy and consent has been ignored for years, and now it seems it will be trampled on by the people in government who are supposed to protect her. I stand here on behalf of 10,000 Victorians to say enough. You have no business showing our medical records to people unless we say so. Privacy is a human right, and our rights should never be sacrificed for convenience.